Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang. Senator Stone. Senator Taylor. Senator Titus. Chair Doñate.
And I am here. Good afternoon, everyone, and thank you so much for joining us. Today, we have a bill presentation on Senate Bill 188. I will go ahead and walk through the housekeeping items, and then because I am the sponsor of the bill, I'll turn over the gavel to our Vice Chair today. So just a few housekeeping items. Today, just know that we only have one agenda item, which is Senate Bill 88. For those that are willing to testify, we ask for folks to please sign in at the table by the door and to provide a business card to the committee secretary. If you do not wish to testify, you may want to sign in so there is a record of who is interested in a particular bill in the event that the committee needs to contact you later. When testifying, please turn your microphones on to speak and off to listen. And we have listeners and viewers in Las Vegas and online that are recording this meeting, as it will be available on the legislature's website later. We also, if you have noticed, because it is a language access bill in healthcare, we do have language sign interpreters that could make it more accessible for folks that are watching, of course, from the public. For any public comments that are provided at the end of the meeting, we ask that they be kept for 2 minutes each so that everyone interested can speak and be accommodated. And finally, we ask for folks to please turn off their electronic devices, especially for cell phones, or put them in silent through the meeting. So with that, I'm going to go ahead and open the hearing on Senate Bill 188, which establishes procedures to assist certain persons with limited English proficiency in accessing healthcare in certain circumstances. And with that, I'm going to turn the gavel over to our Vice Chair.
Thank you, Chair. Come on up, have a seat. Welcome to you, Chair, and to your co-presenter. Please settle in and then begin when you are ready.
Good afternoon, Fabian Doñate for the record. Good afternoon to the members of the Committee on Health and Human Services. For the record, Fabian Doñate representing Senate District 10 in Las Vegas. Today, I come to you to speak on Senate Bill 188, a bill that will ensure meaningful access to language services for individuals with limited English proficiency while safeguarding Nevada children from being asked to facilitate conversations beyond their maturity. Today, I am joined by my intern, Leticia Delgado, who will go ahead and present this policy. Today, we will cover the bill language, background, and national trends and solutions relating to Senate Bill 188, and I'm going to go ahead and turn it over to Leticia in one second. So she's going to go over the background of what we're going to talk about today and the importance of this bill, but more of a personal reason. So many of you know the reason why I got into public health was because when I was a teenager, I was the one that translated for my dad when he was diagnosed with type 2 diabetes. It showed to me a few things. Number one, it provided a level of frustration because oftentimes as children of immigrants, right, we have to translate forms for our parents, whether it's the permission slip to go on the field trip to the DMV, or in my scenario, translating for my dad's diagnosis. And when he got the diagnosis, I was the one that was walking through with him, reading the slips of, how we needed to draw his blood so that we can monitor his glucose level, what we needed to change a part of his diet. And it made me frustrated as a kid because I realized that oftentimes I should not have been put in this situation. My dad deserved to have services available to him that I myself as a kid could not provide. And that's a situation that many children often have to go through. And, luckily for me, I chose to study public health because I wanted to make sure that no other kid fell into the same similar circumstance that I did as a kid. And so that's kind of what the provisions of Senate Bill 188 will cover. And so now I'm going to turn it over to Leticia to go more over the background.
Thank you, Senator Doñate. My name is Leticia Delgado, and I'm very appreciative of being able to present in front of the committee members and the vice chair. SB 188 is an act relating to healthcare, requiring certain healthcare facilities and providers of healthcare to take reasonable steps to provide a person with limited English proficiency with language assistance under certain circumstances. It prescribes requirements governing the use of interpreters and translators to comply with that requirement, and it authorizes the discipline of certain healthcare facilities and providers of healthcare for certain violations. So I want to begin by contextualizing the current state of representation in the healthcare workforce. Nevada is home to a diverse range of ethnicities, and languages, with 29.3% of residents speaking a language other than English at home. However, our healthcare workforce doesn't always reflect this significant ethnic diversity. The most notable gaps are found within the Latino community, where only 1% of medical graduates are Hispanic, despite this group making up 29.9% of the population. Although these numbers are a little bit, maybe like 5 years outdated. The percentage has increased, but only marginally. While anyone can provide excellent care, research shows that cultural competence leads to better health outcomes. Patients often feel more at ease when their healthcare provider can communicate in their native language, and this is evident in the number of children who are tasked with interpreting legal and medical documents for their parents. In some families, the ability to translate for their parents is viewed as a rite of passage or even a source of pride. But the reality is that children lack the life experience necessary to convey such important information. Children can't preserve tone, they can't preserve nuance in translation, but there are a variety of professionals that are able to do so effectively. The federal government acknowledged this challenge and addressed it through Section 1557 of the Affordable Care Act. This section prohibits children from serving as interpreters or providing language assistance to individuals with limited English proficiency. It applies to health programs or activities that receive direct or indirect federal financial assistance from the Department of Health and Human Services, including but not limited to state Medicaid agencies, Medicare, health insurance plans, most hospitals, and healthcare providers. Now, while many states have largely overlooked this provision, yes, some, such as Alabama and Maine, had codified the protection of underage interpreters into their state laws. Nevada, despite being the third most diverse state in the country, has only 12 provisions related to effective communication in healthcare, and none of these provisions offer protection for children in these situations. With that background in mind, I will now hand it over to Senator Doñate to provide a further explanation of the bill. Thank you.
Thank you so much, Leticia. So just going over what we're presenting today, right? This bill aims to do the following. So number one, it codifies what's already existing in federal statute. So the provisions that we wrote for this bill are already required under the Affordable Care Act federally. And so that is where we took all of the language for the bill. It makes sure that language assistance services, so interpreters, remote interpreters, must be free and accurate and timely to protect the individual's ability to make independent decisions for when they get a particular diagnosis. And then, of course, it also makes sure that there are qualified interpreters and translators that can be used so that the healthcare providers cannot require individuals to provide their own interpreters or pay for these services. It's funny because, oftentimes as folks that work in this space, right, we may not always have the skills or the ability to translate correctly, and my main thing is let's not put kids in that position, right? Luckily for me, it was type 2 diabetes, but I would not want to be the kid that told my dad that he had a terminal or end-stage disease or cancer or so forth, and it could have been way more egregious, and I know there's plenty of trauma with children having to translate diseases that probably are not appropriate for children to be in that position, and so that's kind of what we're trying to do today. So with that, Vice Chair, we're open for questions.
Thank you, Chair. We will have open it up for questions, and we're going to start with Senator Stone.
Well, thank you very much, Madam Chair. And Leticia, you did a beautiful job presenting the bill. Congratulations to you. And Senator Doñate, it's a very well-intentioned bill. And you refer to the ACA, you refer to federal regulations that this is covered in some ways under federal law. So can you explain to us why you feel the necessity to maybe duplicate the effort here at the state level? And if I understand it correctly, the states of Alabama and Maine have already undertaken this and put it into law?
Thank you. So that's correct. So the Department of Health and Human Services started promulgating these rules several years ago. They were codified recently under the provisions of the Affordable Care Act that deal with discrimination. The question now becomes, right, there are two things that could be potential scenarios. One, what happens if the regulations are overturned or changed later on, right? Like, are we adhering to those standards? And two, right, often what happens is that the federal government makes changes, but there's no enforcement mechanism at the state level, because ultimately the state is the one that's responsible because these providers are here, right? And so we want to make sure that whatever is passed federally is also being required here in our standards, and we're adhering to the same thing. And so that was more so the reason. There's always a question of, well, are we duplicating efforts if this is already required? My thing is, let's codify it to make sure it's protected and that we are adhering to the same standards, because God knows what the federal government does.
And if I could follow up. Thank you. Thank you for those answers. And do these interpreters, do they have to be certified in any way, HIPAA compliant, ensuring that they have the cognitive skills to translate and what sometimes can be very complicated language? And do you allow for the utilization of electronic interpreters? That I think some hospitals have that technology already today.
Thank you so much, Fabian Doñate, for the record. Yes, absolutely. So for many of these interpreters, there is a certification process that they have to go through in order to be able to provide the level of services, which is why the bill distinguishes between qualified interpreter and someone that is not qualified, right? In the bill, there are provisions that allow case scenarios if you are not a qualified interpreter. So for example, one of the situations that came up was, well, what happens in the instance of, you're in a small town or you're in a small facility, there's no one around except for the kid, and you could potentially put the person in danger if you don't if you're putting in state law that they can't translate on behalf. So the bill does allow for that flexibility in that certain instance. And ultimately, you brought up a good point, right? We are seeing this in real time right here in the committee room, where technology is already providing the language services. And so I did not want to interfere with the technology that's already being applied to, right? So the bill is structured right now to be in compliance with the technology changes, and oftentimes you'll hear from the hospitals, they already are implementing the provisions of this bill. So
Thank you, Senator.
Thank you, Senator, and thank you, Chair. Senator Titus?
Thank you, Chair, and I appreciate you. I've heard your story before regarding your, and so I was glad that you did do that for your parents, because it pushed you forward in a pathway that maybe you wouldn't have otherwise. So there was good that came out of that. My question is, in so many ways, technology is changing, and now I can speak into a phone, and AI can, in any language, pretty much come back to me and translate that for me. So I'm worried sometimes that we are putting laws in that are already behind, and down the road, do we really, in my rural area, we have a phone that we can pick up and we get the interpreter on the phone. We have certified folks, especially in the Spanish language, and I'm not proficient in Spanish, but when it comes to healthcare, I have pretty good, because I do find it relaxes patients. When I can walk in the room and I ask them in Spanish where it hurts and how long it's been there, you can just see that they relax a little bit more, though. And so I think that's important. But wondering if we really do need that, if we are already doing it, and if I worry that and I've said this on the floor already this session, putting stuff into statute when technology changes so fast, I believe we should have some interpretation. I think we do. We do have phones that call, and we do have AI now on our phones. And then having yet another law that mandates certain things just makes me very anxious.
Thank you so much, Fabian Doñate, for the record. My understanding of the federal statute that we're now codifying into state law is it does not prohibit the usage of technology, and they were very careful with doing that because obviously technology is evolving. And so this bill just says that there has to be, when it comes to machine learning, because I think that's the conversation that we're having, is that there should be a verification of what the machine is outputting. So for example, as we're looking right now in the committee room, right, there might be information that the machine is not picking up correctly based on my enunciation of what I'm telling you, right, based on my dialect and so forth. And so the bill just says that there has to be someone that qualifies that what it's picking up is correct. That's more so what it deals with machine learning. It does not prohibit the use of technology to be able to provide that service.
And follow up, if I might. So that's my concern, though. You're going to have somebody, a body, to say, yeah, everything. So it's almost duplication. You're going to mandate that there's somebody there that can document that everything I'm saying right now is exactly what I said, and that language there. And sometimes that's going to be almost impossible to have, especially in certain areas, if you're going to mandate that, again, somebody has to confirm that the interpretation of what I'm saying on the screen is actually accurate. So I have concerns about cost, accessibility, and as technology is going forward, I think that it's going, and it's already mandated from a federal level. I just worry about putting stuff into yet another law.
Yeah, Fabian Nunyachi for the record. And we can talk more offline about the revisions to that if we wanted to make it. The other thing that I would say is, I'll give you an example. Perhaps we might use this in my clinic, right? Many of my providers use the Dragon, right, which is you speak to it and it'll record for you based on the the services they're providing for your patient. But obviously you have to look at what the Dragon is typing for you, right? And so it's kind of that same level of care, right? We want to make sure that what we're using, the services, as we're implementing the technology, that it's actually correct. That's all the federal standards supplied for. But if there's things that you would like to change, I'm happy to talk with you offline about it.
Okay, thank you, Senator. Any other questions from the committee? Okay, seeing none, thank you so much for the presentation. Thank you, Chair. And we'll have you come up for closing remarks after we open it up for anyone who would like to testify in support. Is there anyone here in the room that would like to testify in support of this bill? Come on forward. If you're in Las Vegas and you'd like to do that, please come forward as well. We'll get to you as soon as we finish here in the room. Okay, please state your name, spell your last name for the record. Okay, and then you'll have 2 minutes.
Madam Chair, thank you, and members of the committee, thank you. I am Eric Wilcox, E-R-I-C-W-I-L-C-O-X. I am a parent of a deaf child, and I am chair of the Nevada Commission for Persons Who Are Deaf and Hard of Hearing. The Commission supports SB 188. In fact, the lack of accessibility to American Sign Language interpreters in healthcare settings is one of the most common challenges that we hear about in our regular town hall meetings across the state with members of the deaf and hard of hearing community. Thus, we support any effort by the state to improve access to healthcare for our community or others who are similarly impacted. For our community, American Sign Language is their first and or primary language, and we understand that there's a separate bill potentially in development in the Assembly that is aimed at addressing the specific issues of access to sign language interpreters in hospitals and healthcare settings. So I'll just say thanks to Senator Dunyate for working with us and our community, as well as the other communities facing this issue on legislation, and we'll look forward to working with the Senator and the Assembly to address the specific needs of deaf and hard of hearing community in the appropriate setting. But I'd just like to finish by saying that in our travels around the state, meeting with members of the deaf and hard of hearing community, we have heard and documented truly harrowing stories of lapses in communication in hospitals and clinics that risk the well-being and maybe even potentially the lives of members of our community. So we thank you for working to address this important issue.
Thank you, Mr. Wilcox. Please go ahead, state your name, spell your last name for the record, and you'll have 2 minutes.
Thank you so much, Chair, Vice Chair, and members of this committee. My name is Catherine Nielsen, last name Nielsen. I'm the Executive Director for the Nevada Governor's Council on Developmental Disabilities and the Vice Chair of the Nevada Deaf Commission. And ditto, to save you guys some time. Thank you so much.
Thank you, Ms. Nielsen. Is there anyone else here in Carson City who would like to testify in support? Okay, seeing none, we will go to Las Vegas. Were anyone there in the room who would like to testify in support of Senate Bill 188, please come forward. I see someone that's there. And so please make sure you lean in and just turn on the mic and speak clearly and state your name and spell your last name for the record. Oh, she's signing.
Hello, for the record, my name is Shelly Freed. Actually, this is the interpreter. Can I get zoomed in on that individual so I can see her signs better?
Can we get
please?
closer? Is that better?
That's better, yes. I am a representative for the Las Vegas Deaf Senior Citizens, and I support this Senate bill. This state has 1.3 million deaf individuals living throughout the state. And I want to clarify that some of the answers from the Senate that they have here in this room, AI interpreters is something that is not accessible for American Sign Language. We need to have some type of distance interpreters. We have issues for the hospitals. We have lots of things, and there are not enough interpreters available, especially when it's related to the video. For example, Last week, I had one individual that went to a well-known hospital here in Las Vegas. They had 3 VRIs stored in-house, 3 virtual remote interpreting machines stored in-house, but all of those machines were not running. They were not accessible. They were not able to be used. And so the law states that you need to provide that responsibility for the hospital. They need to provide that interpreter. So we need to make sure that if they're relying on that video interpreter, that they have machines that are working, that the staff is trained to know where to find those machines and also how to use them. Also, another thing that I'd like to clarify, children used as an in-person interpreter is not okay. They should not be interpreting for their parents. They should not be interpreting at all. We have to provide an in-person certified interpreter. Anybody under the age of 17 should not be required to interpret for anybody. I learned that those 3 hospitals in this situation, they even have data on how deaf outpatients how they are trying to access that every day, and they're advocating for language access for deaf and hard of hearing individuals, opposed to other foreign languages. They have data on that, specifically for other languages, but there's not data for deaf and hard of hearing individuals and accessibility to American Sign Language. Thank you.
Thank you so much. Is there anyone else there in Las Vegas? We appreciate the interpreter there, so we can get the comments of that commenter. And no one else in Las Vegas. BPH, is there anyone on the phone lines who would like to testify in support of Senate Bill 188?
If you'd like to testify in support on SB 188, please press star 9 on your phone to take your place in the queue. Caller, you are unmuted and may begin.
Thank you so much. Good morning, Vice Chair and members of the committee. My name is Henry Rosas, R-O-S-A-S. I serve as the External Affairs Manager with United Way of Southern Nevada, and we're in strong support of SB 188. United Way is committed to ensuring every Nevadan is able to receive social services equitably. And over the last year, we've implemented a statewide language access program, which actually includes funding nonprofits to provide healthcare services to limited English proficient communities. And so we see on a daily basis the power of providing language access services, including translation and interpretation to Nevadans so that they can live fuller and healthier lives. So thank you so much for hearing this bill today, and we urge your support of SB 188.
Thank you, Mr. Rosas. Is anyone else, BPH?
Chair, there are no more callers for support at this time.
Thank you so much. And now we'll open up the opportunity for anyone who would like to testify in opposition to Senate Bill 188. Please come forward here in Carson City or there in Las Vegas. Okay, seeing none, we'll go to the phone lines. BPH, is there anyone who would like to testify in opposition?
If you'd like to testify in opposition on SB 188, please press star 9 on your phone to take your place in the queue.
Good afternoon. Good afternoon, Chair and committee members. My name is Denise Bolaños, Bolanos, and I'm the Associate Director of Return Strong Nevada. I support the bill's intent, but I would urge legislators and Senator Doñate to clarify whether it applies to incarcerated individuals and medical centers inside of prison facilities. People in prison can't just use their cell phones for translation and rely entirely on prison medical staff for language access. Without mandated interpretation services, language barriers can lead to misdiagnosis and improper treatment, and it already has. I have personally spoken to people in prisons about the issue, and they relied on another person who happened to speak that language because it was the only option presented to them at the time. If prison medical facilities are not covered, I strongly urge an amendment to include them. Everyone, regardless of incarceration status, deserves equal access to healthcare in their language. Thank you.
Thank you so much for calling in. Do we have another caller?
There are no more callers in opposition at this time.
Thank you so much. And now we'll open up the opportunity for anyone who would like to testify neutral to Senate Bill 188. Please come forward here in Carson City. And if you're there in Las Vegas, please take this opportunity to come forward as well. Thank you so much. Please go ahead and begin when you're ready. State your name for the record.
Thank you, Madam Vice Chair. My name is Patrick Kelly. I'm with the Nevada Hospital Association, and I always struggle with the protocol of whether you come up in favor, opposed, or neutral, because we have been working with Senator Doñate for several weeks, and he was kind enough to have a discussion with us. We talked about it would be great if we could tie this into the federal regulations, and he and his staff did a fantastic job of doing that, and we're very comfortable with it. We did have another meeting where we came up with just a couple small little items that he said he was going to offer an amendment to, so because that amendment's not up, I guess I come in neutral. But just so appreciative of the sponsor working with us and really having a great dialogue with him. Thank you.
Thank you, Mr. Kelly. Please go ahead, state your name for the record. You'll have 2 minutes.
Thank you. Good afternoon, Vice Chair Taylor and members of the Senate Health and Human Services Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. Central to our mission is ensuring our physicians can advocate for their patients, and we believe clear communication between a patient and their doctor is important to provide quality care. Currently, our physicians provide interpretation services to patients who need them, but the associated costs can be significant. For example, ASL services can run $125 an hour with a 2-hour minimum. For other language interpretation, even using phone or video services can run $3.95 per minute, which doesn't sound like a lot, but calculates to $237 per hour. And the interpretation service is utilized throughout all stages of seeing the patient, from booking the visit to the visit itself and all the way through billing. For my physicians who take Medicaid, some of these visits will pay $30, a fraction of the cost of even providing the interpretation service, much less providing the medical care itself. These costs are even more of a financial strain on the practice resources if you take into account patients that no-show their appointments. But of course, our doctors want patients to understand their disease process and be informed. Therefore, we appreciate that Senator Doñate has introduced this bill, and we're grateful for the opportunity to engage in conversation about how best to address language barriers in healthcare. We understand and share the goal of improving access to care for all patients. At the same time, we want to ensure that any solutions also support the viability of small private practices. We believe there are opportunities to find common ground, and such as utilizing technology, maximizing the potential of HIPAA-compliant medical staff for translation, and exploring existing and future translation and translation training resources through insurance plans and nonprofit partners. By collaborating and sharing insights, we're confident we can achieve better communication for patients and a sustainable approach for our physicians. We truly thank Senator Doñate for his leadership on this issue, and while we remain neutral today, we are eager to work together with him, and he's been great working with us to reduce language barriers while keeping the needs of physician practices in mind. Thank you.
Thank you, Ms. Nguyen. Is there anyone else here in Carson City who would like to testify neutral?
Can I ask her a question?
Oh, please, Ms. Nguyen. Ms. Nguyen, a committee member would like to ask you a question, please, if you wouldn't mind. Senator Lang?
Hi. So I'm just wondering if you have any translation services available in your practices at this time.
Yes.
And what would
we are
that
compliant.
entail?
So it's a little different for all of our members when we've polled them. So some will use, there's a couple things that is available to them. Some do bring in live bodies for sign language. Some do use call-in. Some do use call-in with video. So there's a variety of ways that they already provide the service, yes.
Thank you. And I'm wondering if I can ask the same question of the hospitals.
Just before you switch, Ms. Wynn, don't leave because someone else has a question for you. So please come forward.
Right now, thank you for bringing up the cost, because I think we do provide this, but there's a cost to this. And so far, has anybody looked at reimbursement for that added on? I mean, we see a patient, we put a code in, we get reimbursed or not. But then can you do an additional cost? Is anybody looking at that cost of providing the interpretation?
Jacqueline Wynn for the record. Yes, we have looked at that, and we've actually discussed that with Senator Donate as well. I believe that he's looked into some of the MCO portions. Again, my doctors are saying, it's one thing to ask for reimbursement, it's another thing versus what they pay. But we're open to continuing to explore all of those options.
Thank you, Ms. Wynn. Please go ahead, Ms. Wilcox. Please state your name for the record, and then Senators. Okay, so don't go away. We'll stay here. No. Okay. Ms. Wynn, you're popular today. Please go ahead, Senator Lang.
Let me just ask a quick question. So, can you tell me how many people you surveyed to get this information out of how many doctors you have?
Thank you, Senator Lang. Jacqueline Wynn for the record. We didn't do a robust survey of our entire membership. We talked to our legislative groups, but in digging into this, we have committed to furthering the discussions with Senator Donate. So what I can do is, if need be, I can do a more robust survey and I get that information to the committee and to the senator as well.
I think that would be important information, but I'll leave that up to Senator Donate as he continues to work on the bill.
Thank you.
Thank you, Ms. Wynn. So if you wouldn't mind following up with the senator on that. Fantastic. Please go ahead. You have a question for Ms. Wilcox? Senator Lang?
Mr. Kelly. So my question to you, I just am interested how many of your hospitals, many, a lot, all, are doing translation services?
Patrick Kelly for the record. We're required under federal law to provide these services, so my hope would be all of them would do it. I did hear the earlier speaker, maybe we're not doing it perfectly, and we're going to strive to do that. But all of them do it. I would say that it varies a little bit. They have the same issue that we do, is the smaller facilities will have the service and everything, but the larger facilities typically have a little bit more robust services available, especially during the day and stuff, because we have different Spanish-speaking personnel and different folks that can help with those types of things. But the service should be available at all times.
So what I'm not understanding here, and Senator Dr. Titus just told me, reiterated that it's a federal mandate. I'm not understanding why the doctors have such a problem when it's a federal mandate to be able to do these translation services.
Who's that directed to, Senator Lang? Mr. Kelly?
No.
Ms. Wynn, please go ahead.
Jacqueline Wynn for the record. No, we're absolutely, again, committed to making sure we know that we want our patients to understand the process. So we're not here in opposition. We wanted to be able to bring forth all of the information necessary for you all to understand the costs associated. Again, we're absolutely committed to Senator Donate to working through some of these things. One of the things that we did identify is, the ability to use our staff, which is HIPAA compliant. So there's just So I think there's absolutely room here, but certainly I didn't mean to convey in any way that the physicians are not supportive. Patient care comes first and foremost, and part of that is having the patients understand. Thank you.
Thank you, Senator. Senator Titus, you're good? No, I'm good. Okay, thank you very much. Mr. Kelly, I'm sorry I called you Mr. Wilcox. I know that. Mr. Kelly, Ms. Nguyen, thank you. Thank you so much for coming forward. Still seeing no one in Las Vegas who would like to testify neutral. Then BPS, is there anyone on the phone line who would like to testify neutral on Senate Bill 188?
If you'd like to testify in neutral on SB 188, please press star 9 on your phone to take your place in the queue. There are no callers in neutral at this time.
Thank you so much. Chair, would you like some closing remarks? Chair Doñate?
Thank you so much, Vice Chair Fabian Doñate, for the record. So one of the things that you heard that we're obviously working more on it's more on the details, not really of the policy. What we're trying to pass is obviously the nuances of how do we make sure that, like, if you have a Spanish-speaking staff and, right, if you don't have the interpreter, can they still serve in that capacity? Well, what qualifies them to be the person to do so? The billing cost came up, of course. I would like to remind you that there is a billing code. It is T1013 that was established by CMS already, that providers can already bill for this service. MCOs, from the ones that I've talked to, already provide this as a service available to their patients, and so we already do this. Is in terms, like, the funding issue is not an issue, right? The issue that I'm trying to solve is not putting kids in the position where they're having trauma because they have to translate for their parents. There's plenty of money in our healthcare system to prevent that situation from happening, and so that's more of where I'm standing. But let's remind each other, right? As I mentioned, this was a federal regulation that was passed under the Affordable Care Act's section on discrimination. But the Civil Rights Act, that has been a part of the country for the last, 50 plus years, requires language access if you are receiving federal funds. And so that, for the doctors that are taking Medicare and Medicaid, they should have been in compliance with that a long time ago, but no one's watching and making sure that they are in compliance. My bill finally stops that practice from being enacted, and so that was more so the provisions. But obviously, we're going to work out the details and the considerations for technology. I completely agree, and I just want to make sure that we're not putting kids in that situation. So,
thank you, Senator. Senator Lang, Senator Titus, I think, has a question.
Yeah, just back to the bill, though, and because your bill says it must be provided free of charge. So does that mean, so they can't bill for it to the insurance company, or? So I'm just curious about that. Consider, service to provide language assistance to ensure compliance be provided free of charge to the person with limited English proficiency. So I have a cash paying patient that comes in, you can't charge them extra because I use an interpreter?
thank you so much, Fabian Doñate, for the record. So that's for the patient themselves to receive the service. That's not, that right? If I show up to a provider visit, right, and I need Spanish interpretation, there could be potential delay in terms of if I'm coming in for a situation, right, the provider should be responsible in making sure that the patient is able to get access to the information if you're going to make a diagnosis. And so this is providing that at least the onus is not on the patient. And again, I just want to remind you, this is already a requirement under federal law. And so we are just now codifying what is already required into state statute. So regardless if we agree or disagree, it already is required under federal law. Just making sure we're all on the same page.
Thank you, Chair. Any other questions for Chair Doñate? Okay, thank you very much. We will close this hearing on Senate Bill 188 and go to the final item on our agenda as the Chair returns, and that is public comment. If you're here in Carson City and would like to make public comment, please come forward at this time. You will have 2 minutes. We ask you to state your name clearly for the record. Seeing no one coming forward in Las Vegas, if there's anyone there who would like to have public comment. Okay, seeing no one coming forward, then BPS, is there anyone on the phone line?
The public line is open and working. However, there are no callers at this time.
Thank you so much, Vice Chair. So that concludes the agenda items for today. We will have a meeting on Thursday where we'll hear 2 bills, including one from our senator down to the left of me. And so we look forward to having folks come on Thursday, and the meeting's now adjourned. So thank you so much. And thank you to our Vice Chair.